Welcome to the deep dive. Today we're looking at keratoconjunctivitis sicca.
Or dry eye syndrome, as most people probably know it.
Exactly.
Right.
Super common, right? So our goal here is to, pull out the key info you need for revision. Quick, clear, effective.
Yep, the high-yield stuff. We'll hit definition, causes, management, the whole lot, with some memory tips thrown in.
Okay, let's start right there. Definition. What exactly is dry eye syndrome?
Well, it's basically when the eye surface isn't properly lubricated.
Yeah.
And that can be for two main reasons.
Right. Either you're not making enough tears.
Or, and this is really important, the tears you do make are evaporating too quickly. It's an OR situation.
Got it. So lack of production or excessive evaporation leads to dryness, inflammation, discomfort.
Precisely. Now, what causes this imbalance? What's the etiology look like?
Okay. There's a little memory aid that can help here. Think AH-HSED.
Right.
Okay, break that down for us.
Sure. So A is for age-related changes. Another A for autoimmune disorders, think Sjögren syndrome, for instance.
H for hormonal changes. Another H for hypersensitivity, which often relates to medications. Antihistamines are a classic example.
Right. They can be very drying.
Then E for environmental factors, like living in a really dry climate. And S for systemic diseases, maybe like diabetes.
AH-HSED, that's
Yep.
pretty useful. Age, autoimmune, hormonal, hypersensitivity meds, environment, systemic. Okay.
So building on that, who's most at risk then?
Well, there's definitely overlap with the causes,
Hmm.
like you'd expect. Advanced age is a big one.
Nah, seems to get more common as we get older.
Absolutely. And being female is another key risk factor. Hormones, again, especially around menopause.
Makes sense. What else?
Those medications we mentioned, definitely. Also, having had eye surgery before or being a regular contact lens wearer.
And the environmental stuff too, right? Wind, dry air.
Exactly. All things that increase your susceptibility.
So let's dig into the pathophysiology a bit. What's the core mechanism going wrong here?
It really boils down to an imbalance, like we said. Either in tear production, the quality of the tears isn't right, or they're draining away too fast.
So the eye surface just isn't getting that consistent moisture and lubrication it needs.
Precisely. And the result?
Mm-hmm.
Inflammation, that gritty feeling, discomfort, and potentially damage to the cornea and conjunctiva over time.
Okay. Now someone comes in with red, sore eyes. It sounds like dry eye, but what else could it be? What are the differentials we need to consider?
That's crucial, yeah. Because the management can be quite different. You've got to think about allergic conjunctivitis.
Which often has more intense itching, maybe seasonal.
Right. And blepharitis, that's inflammation of the eyelids themselves. That can cause similar irritation.
Okay.
And a really big one is meibomian gland dysfunction, or MGD, where the oil glands in the lids aren't working right. Very common overlap with dry eye, or can mimic it.
Right. Getting that diagnosis correct is key. How common is dry eye? What's the epidemiology?
Well, it's pretty widespread. Estimates vary quite a bit, like maybe 5% up to even 35% of people in some studies.
Wow, that's a huge range.
It is. But generally, prevalence increases with age, and like we mentioned with risk factors, it's more common in women.
So what are people actually feeling? What are the typical clinical features they complain about?
The classic symptoms are that feeling of dryness, obviously, itching, a burning sensation, redness.
That's something in my eye feeling.
Yeah, exactly, that foreign body sensation. Also, vision might get a bit blurry, and increased sensitivity to light is common too.
So think about the feeling, dry, itchy, burning, foreign body sensation leads to red, blurry, light-sensitive eyes.
Perfect summary. And symptoms can fluctuate, often worse later in the day or in specific environments, like an air-conditioned office.
Okay, so how do we investigate this? If someone comes in with those symptoms, what tests are done?
It always starts with a good, comprehensive eye examination, looking closely at the eye surface, then specific tests like Schirmer's test. That measures tear production, basically how much tear volume you're making, and also evaluating tear film stability. That's often done with a tear breakup time test, or TBUT. How long does the tear film stay intact before it breaks up?
And checking the meibomian glands too, I imagine.
Absolutely. Evaluating the ocular surface and those glands is key.
Right. So diagnosis is made. What's the plan? How do we manage dry eye?
The main goals are really threefold. Relieve the symptoms, improve the stability of the tear film, and prevent any damage to the eye surface.
How do we do that?
Well, the first step is often artificial tears. Lots of different types available. Lubricating ointments, especially for nighttime, can help too.
Lifestyle things as well, like humidifiers.
Yeah, simple things like that can make a difference. And importantly, managing any underlying conditions, like if Sjögren's or blepharitis is involved.
What about for more severe cases?
Then you might move on to things like punctal plugs, tiny plugs put into the tear ducts to stop tears draining away so quickly, or procedures like meibomian gland expression to clear out blocked glands.
Gotcha. What's the long-term picture? The prognosis?
It's often a chronic condition, unfortunately. It doesn't usually just go away completely.
So ongoing management is needed.
Yes, but the good news is that with the right management, most people can get really good relief from their symptoms and prevent serious issues. So the prognosis is generally pretty positive with proper care.
That's reassuring. But what if it's not managed well or it's very severe? Are there complications?
Yes, definitely. Untreated or severe dry eye can lead to actual damage to the cornea abrasions,
Oh,
ulcers in worst cases.
ouch.
Yeah, increased risk of eye infections too, because the tears aren't washing things away properly. And just, a significantly reduced quality of life from the constant discomfort and visual issues.
So it really underscores the need for prompt diagnosis and sticking with the management plan.
Absolutely.
Okay, so wrapping up, dry eye. Very common, loads and potential causes, but thankfully manageable for most people. Early recognition and treatment are key.
Exactly. And maybe a final thought for everyone listening, just take a moment to consider your own daily environment. How much screen time are you getting? Is the air very dry where you work or live? Could these factors be playing a role in your own eye health? Something to think about.
That's a great point. And if you want to dive deeper or revise this topic further, definitely check out MSRA.com.
And fiercery.com for more resources.
Thanks for joining us on this deep dive.